COVID-19, pandemic, stay safe, get tested, 6 feet, lockdown. That's all we've been hearing all year. COVID-19 has come into all of our lives and changed it very much. Who would have thought that we would be going through this right now in the United States at that? Not me. Some stores don't even have signs in their establishment stating that you have to have on a mask upon entry. In the beginning of this pandemic, there was a lot of establishments that was turning people away because they didn't have on a mask. But the rule wasn't enforced. I guess nobody took this virus serious, did they? Look at us now. I'll be letting you know that wearing a mask during this COVID-19 pandemic is very essential and can decrease the spread of this virus. I also will be talking to you about what is COVID, how is COVID transmitted, things that we can do to not get the virus, and things that we can do to decrease the spread of the virus. Last but not least, my personal experience with working in healthcare during this COVID-19 pandemic. Understanding what COVID-19 is and how it's transmitted can give a person a better idea of why it is important for everyone to wear a mask in a public setting. According to the World Health Organization, the best way to prevent and slow down the spread of this virus is to educate people about the virus. COVID-19 is transmitted through microscopic particles of saliva that travel when you cough or sneeze. Wearing a mask can help stop the spread of the particles by simply keeping the germ to the infested person. According to the Mayo Clinic Foundation, the best time to wear a mask is, of course, in public. Another way is around people that you don't live with. And another way is if you're going to be in a public area or establishment with someone, with other people, and you're just really close to them, you don't have enough room, wear your mask. Now, wearing a mask is very easy and simple. This is actually a simple mask. You can get these anywhere. How to wear this mask is the white part of the mask is the part that touches your face. You're going to grab these two little loops, but these are the ear loops, and we're going to put it to our face. We're going to cover our nose, and we're going to take the ear loops, and we're going to wrap it around. Finally, this is like a little metal bendable thing. It's the adjuster. So we're going to take our index fingers, and we're going to put it on each opposite side of our nose, and we're going to push down. That's to adjust the mask to your face to make sure that it's securely on your face and it serves the purpose that it's supposed to serve. These things are not pleasant, but they do help decrease the spread of the virus. Wearing a mask in public is one of the most important ways to decelerate the transmission of COVID-19. By wearing a mask, you're not only protecting yourself, you're protecting your peers. You're also protecting people with compromised immune systems, such as people with COPD, CHF, and asthma. Those are respiratory disorders. Let's not forget our elderly. We have to protect our elderly. Some of our elderly have health problems where if they contract this virus, their body will not be able to fight it off. So we need to start protecting our elderly. They are high risk to this virus. According to Michael Henschner, countries like South Korea, Hong Kong, with almost universal masking, have been some of most successful in reducing positive COVID cases and reducing the death rate. Now, why, you ask? Because they following the protocol. That's why. It's all about protocol. You want to stay safe, you have to do and take measures to stay safe. Simple as that. There are other ways besides wearing a mask that can reduce the spread of the virus, such as social distancing. If you have your mask on and you're practicing social distancing with 6 feet, you are doubling your chances of not getting this virus. Please wash your hands with, please, I cannot stress that enough. Wash your hands with soapy warm water for at least 20 seconds. Keep your hands out of your mouth and your face. Please don't do it. That's a nice way for you to touch something that's contaminated. You can give it to yourself just by touching something that's contaminated and putting your hand in your mouth. If you cough or sneeze, please cough and sneeze in your inner elbow. Do not cough and sneeze in your hand. We was taught that when we were little. Only go out if it's necessary. If it's not necessary for you to be out, don't. Because when you're out in settings, you're putting yourself at higher risk of getting the virus. And then you're not knowing that you have the virus. You can spread it to other people. Now, I want to share my personal experience with working in the healthcare during this COVID-19 pandemic. This past May, I got a text message early in the morning. It was probably about 4 a.m. in the morning. It was from my administrator letting me know that we had 2 positive COVID cases in our facility. 2 hours later, I arrived at work to find out that those 2 cases had now turned into 5 cases. And it just kept going on and going on and going on. Now, I have been a CNA for 18 years, and I'm used to seeing death. But I am not used to seeing death in the numbers that we experienced. We lost residents every week, sometimes twice a day, sometimes 3 in a day. It was the worst part of this year for me. I am a healthcare provider, like I stated before. I sometimes, make a bond with my residents. I lost a lot of my residents that I love dearly. And to watch them go through, this ordeal and me not being able to help them. So I'm a healthcare provider and I've lived through this. And I'm telling you guys the importance of wearing a mask. This virus is real. I have shared with you how COVID is transmitted. I have shared with you the things that we can do to not get the virus and decrease the spread of the virus. I also share with you my personal experience. This virus is real. We all missed before COVID. So if we do this, then we can get this virus under control and we can go on with our normal lives.